Hi, I'm Dr. John Morton. I'm a specialist in facial and ophthalmic plastic surgery. And with me today is Tracie Samara. And Tracie, several years ago, was working to improve the appearance of her face, which was already a natural beauty. And what happened was she had some injections put in that were not legal. This resulted in inflammation and also a disfigurement, especially in the eye area and in the lips. Now today what we're going to do is talk to Tracie so she can tell us a little bit about the story, the history of how this all happened, what she was trying to accomplish, what resulted, and what we're doing now to try to improve her appearance and really get her back to where she was before she had any of this done.
Hi, I'm Tracie Samara, and I always wanted to be a supermodel. Well, I grew up in Portland, Maine, and I entered the Miss USA pageant that was running in 1985, and I won Miss Maine USA, and during the national pageant was voted by the photographers as the girl with the most beautiful eyes. And throughout most of my life, that was what I was told, that my eyes entered the room before the rest of me. And so I moved down to Miami, Florida in my early 30s with my daughter and decided to pursue modeling down here. Had to raise my daughter, so never really still got a chance or an opportunity to travel a lot and make things happen. And so at 45, about 6 years ago, in my mid-age, when models are actually becoming very successful, I decided to go back to my agency, and I entered a contest for a non-invasive facial rejuvenation, which about 400 people entered, and I won.
Now Tracie, when you first went in, did he tell you what he was going to be injecting?
No, actually, it was a little intimidating because I was a virgin, so to speak. I never had any work done at all into meditation and things like that, and I just never thought that I would be sitting there, you know, having this done. And he told me that if I had to ask, that I wasn't the right patient, and he really made me feel bad about asking, so I never asked again.
Okay, and he was focusing on the eye area and on the lips. Is that where most of the injections were?
Yes, I mean, it was a non-invasive facial rejuvenation, but I really wasn't filled in on what was happening every time I went until there I was and received a lot of injections each time.
Did it look pretty good initially when you first started? Were things looking good, or was it would you initially get some inflammation from the injections?
I was told, I mean, I immediately, you know, you can see from the photographs, within hours, just blood like bruising, lips and things. I was told that that was common, but when it continued to happen, he told me that it was probably my vegetarian diet and that I was low in iron, and again made me feel like I did something wrong. And I did go to a doctor actually to see if I was low in iron, which I wasn't.
And about how many injections total do you think you received?
You know, this was 7 years ago, and I swear my system kind of took over. It's all a big move, but I would say each time I went, 15, 20, and I went 5 or 6 times, and that was for the initial injections. And as things went wrong later, I went for many more.
Okay. Once he started to see problems, did he try to correct the problems, correct the issues that you were experiencing?
Unfortunately, yes.
But it did not help.
Well, I don't know if he should have been doing what he was doing. I mean, at one time he tried to stick a tongue depressor into my eye and squeeze the stuff out. It felt very backcountry and barbaric what was starting to happen, which made me start to question and get scared. But at one point, with an overfill over here before a necrotic infection, he punctured it and squeezed, literally, and squeezed, and was like so proud of himself that he did that.
And I remember at one point there's a picture where you have a hole opening here in your eyelid, which was an infection with dead skin on top.
I developed 2 really bad infections over there. Basically, this is after he realized there was a problem and started having me come after hours to try to fix, and he injected something maybe called a hydro something to try to liquefy it, and that basically caused necrotic infection, and that eventually caused another infection over here. I lost a lot of tissue and filler, my natural tissue.
You weren't going to someone's apartment, you weren't going to a hotel, and this is actually a doctor's office,
Yes.
and you were getting all of these complications from these supposedly legitimate fillers.
Yes.
And you can see that what Tracie has had, and we'll show you some pictures too, was basically nodules of inflammatory tissue here that are very, very firm and lumpy and disfiguring, with chronic inflammation causing a redness. And if this was a filler like Restylane, this just wouldn't occur. It wouldn't happen from a normal filler like
And
that.
7 years to still be battling it.
So you finally realized that this doctor was probably not going to be able to help you out. And I know that you went down to Bascom Palmer, and they were able to do at least some surgery to try to improve things. Can you just tell us a little bit about that?
Well, yes, before we actually did surgery, which both eyes were done over a period of maybe 2 years or less, I had fat injections. We tried that. We took the fat from my legs or the thigh and plowed it in there to try to, fill it up, and I looked good and fat for a couple of weeks.
And probably try to smooth out and hide the other nodules that were in there, which sometimes can work, right?
It was interesting. Maybe it would work better now, because then I still had infections and stuff. And with my problem is I burn fat so fast. I don't know, it's my metabolism, but it did not last.
So it disappeared, and you
Really
ended
quickly.
up.
What I call my little shrinking face. But I had a horrible. What you've been doing over the past 7 months has made a big difference. Wendy and I called it the worm, because basically what they thought to do, because nobody's ever done this before or worked with this, was a blether, kind of where people have the fat taken out.
So I think what she did was she went in through here, tried to get rid of some of these nodules, and I can tell by feeling that they probably did get rid of some of them, but there's still some residual hard nodules in here. And I know that the pathology showed that something was injected other than something like Restylane, but more like a biopolymer or a silicone, which is what causes these sort of nodules. And but they're very hard to get out and make it look totally smooth, and I'm sure that's what happened to them down there. They probably improved it, but still, you can still see that there are nodules on both sides, and still some tissue that is not normal from these injections. Now, when Tracie came to me, what we have been trying is a new technique called Ultherapy, which is a deep ultrasound, and it's a deep heat that we run over this area. And what that does is it shrinks down some of these nodules so that they will start to flatten out. In that way, if I go back in at some point, what I will need to take out in terms of the residual nodules will be pretty minimal. And she's at the same time getting some skin tightening from the Ultherapy, which will help to make the skin look better once we do get rid of whatever you have left in there.
So a little eye job, hopefully, but probably never be what it should have been, right? I don't know.
It will be almost impossible to look the same as you did before.
Or like nothing happened.
Yeah, like nothing happened. We will make it look better, but it will never look exactly like it did before.
Well, the Ultherapy is amazing. That is since Bascom Palmer did what they could to remove, and they weren't concerned about the cosmetic appearance of it, because I was saying, why don't you etch it a little bit so you leave a little bit, oh no, we got to get this out, and this was the infection. And so really it was not about the cosmetics at that point, so it was pretty upsetting. And when I came to you and I saw you on TV, I believe it was Anderson Cooper helping other people, about 7 months ago, I had basically just been left from, the Bascom Palmer, basically fraxeling and surgery, and then saying, we don't really know, leave it alone for a while. So I walked around this was really sticking out more. I called it the worm, pretty embarrassing, really kept me in for many, many years. And when I saw you on TV, I said, oh my God, I don't care where he is, I've got to find him, I'll fly to wherever. And destiny lined up, and you happened to be in my backyard.
Down the street.
I know, and I just crawled in here and I said, please
Oh.
And we tried the Ultherapy. The thing is, I noticed even with my lips, it's instant. The Ultherapy has an instant effect. It's been so worth it. People even that haven't seen me for a while or do see me, every time they see me, they're like, wow, you know, it looks so much better. So I have really good hopes that Dr. Martin, you know, over time will make me happier. I hope. So far, so good. If I had to just stay like this, you know, I emotionally, I'm grappling with it all the time, but I'm actually getting my spirit back and my fight back and my personality back and my hope. And I hope to help other women. You know, there's so many people walking around that don't even know that, you know, a little bit of, you know, help with the Ultherapy can make something that looks overly done more natural.
You know, and I think the take-home message here is that you have to be very, very careful what you're having injected into your face or into your body. Even if you go to a licensed physician, you really want to ask them exactly what's being put into you. And pretty much any permanent filler is not approved for injection into the body, or at least as a free substance. So even silicone, which can be used in breasts, you don't want to inject it as a free liquid and inject large volumes because you will develop these sort of complications. Now, with Tracie, what we're going to do is continue with the Ultherapy to shrink down these nodules, and then I will go back in, pull the skin down, try to get rid of the residual nodules, and pull the skin up, and hopefully we'll end up with a nice smooth contour. I've seen a lot of different patients with nodules in their faces, and I can tell you it's very, very difficult to get rid of them, and you really will never get back to the appearance you had beforehand. So you just have to be forewarned that you're really, you know, throwing the dice down when you have these injections done into your face.